Good morning. Welcome to this month's Community Wise podcast. I am your host, Holly Long. And today we have a very special guest with us who not only is a board member for LISC Greater Kansas City, she is all things community in Kansas City, particularly at Children's Mercy Hospital. Please welcome Dr. Denise Dowd.
Hi, Holly. Good morning. It's great to be here.
Great to be
Yeah.
So this month, we're going to talk a little bit about mental health, the 5 social determinants of health, communities, thriving communities, equity, lack thereof, just all of those things that roll into how you became who you are. If you don't mind sharing a little bit about your background and where you came from, and why you got into the business that you did, and what specifically did you do?
Well, so I grew up in Detroit, in the city of Detroit, actually, not the suburbs, for the first, decade or so. And then we moved out to the suburbs. It was the mid-'60s, late 60s. You know what was happening in Detroit at the time. And I'm guessing we were part of white flight.
Yeah.
But there was also black flight, too.
It was. All my family lives in Southfield currently.
So that was the first suburb we actually moved to, was Southfield.
Yeah.
And I think we've talked about that before.
We talked about this.
But people don't know that, like, anybody that had 2 pennies to rub together, they got out of that city. It didn't matter what race you were.
Absolutely.
But more white people had the money to do that, right?
Absolutely.
But anyway, grew up there, oldest of 11 kids, big, huge family, and I have 7 brothers. So why I got into what I'm doing is pediatric emergency medicine and preventing injuries. Well, that's self-explanatory if you have 7 brothers, right? So who's going to jump off the roof next to see if they can fly? That kind of thing happened all the time in my family. So I came about it real, kind of honestly that way. But I started as a nurse, and I was down on in downtown Detroit at an old Catholic hospital, lived down there in the nurse's home. And that was my first exposure to people who were medically very sick at a very young age. And they were all people of color.
Of course.
Active tuberculosis, drug addiction, all kinds of cardiovascular stuff, hypertension, kidney failure. These people were in their 30s and 40s, which I didn't. In my family, people were fairly healthy. So that was really my first exposure to kind of the impact of poverty and the impact of just not having enough just to get by. And that got me on a trajectory. That was 1977. So I don't know how you can do the math. I don't know how many years it's been. I think it's been like 4.5 decades or something like that.
A little more than 40.
Yeah. And so that got me super interested. And I ended up, going to medical school eventually, kind of working a little bit and then going to medical school and then being interested in pediatrics. And that was a real simple reason. It's because you can be really goofy and honest and authentic in pediatrics because kids keep you that way. Yeah. So I just liked it, liked the people. And then my first rotation in the emergency department, I was like, yeah, these are my people. I like the action. I like the quick pace. I like the diversity of cases, all that kind of stuff. And then from there, I got to, and I trained here in emergency medicine at Children's Mercy Hospital in my fellowship. My boss was the great Jane Knapp. She's one of the godmothers of our specialty. It was pretty early at the time. And she really was a person who gently encouraged you to really follow your heart.
Yeah.
And I was so fortunate to have a woman in my life as a mentor and as a boss to do that. And she, encouraged me to go into preventing injuries. So I started an education in that, went to another fellowship in Seattle at Harborview Injury Prevention Center, and then got really, really interested in what they call injury recidivism. I think criminology talks about recidivism, right?
Yes.
You come back into this system.
Re-entry, yeah.
Well, and I'll tell you this study that I did, if it's okay, that really got me hooked.
This is your time. Go for it.
All right. Now, I just read this book by Deborah Prothrow Stith. I think I'm pronouncing her last name. It's called Deadly Consequences. And she was an African-American physician who was at Harvard at the time. She eventually became, I think, the dean. And she was the first person way back then in the mid 80s who really talked about this phenomenon of people coming back to the emergency department once they'd been violently injured. This was before anyone talked about ACEs and, adverse childhood, way, way before. And I wish her name would come up more because she was the first real person to talk about this in healthcare. And I decided to do a study, and this was 1990, I think, 1990. Yeah, probably 1990, 1989, which was a really tough time in Kansas City.
It was.
That was crack, right?
It was crack.
And it was bad. I mean, there were kids being shot, and I had come from Chicago where I was trained, which was really, I was in the sort of shadow of what was called Cabrini Green.
Oh, yeah.
Okay. And so that got me super interested in little kids being caught in the crossfire. Like, this is so tragic and unnecessary. And so I decided we had to do a research project as part of our fellowship. So there were so many kids being shot. I just decided to just be like little junior scientist and go ahead and just describe over one calendar year all the kids under the age of 16 who had been shot in Kansas City. And I counted them up. So I had to go, and I actually had to go to every hospital to look at their records. I had to go down to the caves, which is they have a lot of medical records and death certificates down there. And I sat in these medical records departments throughout the metro as I was looking at these cases of kids who had been shot. Some had died. Some survived their injuries. And as I'm like just leafing through this, and all I was trying to do is like, how old were they? What time did this happen? What day of the week? What street did they live on? Where did this happen? If we could glean all that stuff, just to describe it, so we have a better understanding of this problem. Well, while I'm in there looking at these records, it was like their medical record. And I'll take it like an example. Kid shot, age 15, who may have died from his injuries. And that medical record contained cases of visits in the healthcare system that started as a baby. Mm-hmm. And it could be, being very, very fussy. It could have been found to have bruises on them that looked suspicious. There could have been, a case where Child Protective Services was called in. The kid was, removed from the home for a part of the time. Then, a few years down the road in there could have been asthma, repeat asthma. And also what started popping up were these mental health diagnoses, right? So ADHD.
Yep. Come on. Talk.
I mean, unbelievably common. So 5-year-old ADHD, put on some medications. And a little, like later on, there might have been a couple ER visits for getting in a fight.
Did we say what color this patient was?
Well, most of the time they were African American, okay? That was the vast majority of kids were both male and African American. So with a few exceptions, but
of course,
by far and away, that's what they were. And I should have brought a copy of that paper because it was so long ago and, we've come so far in our understanding. But, you read the record and then, the kid comes in because his it's called a boxer's fracture because he punched somebody or punched a wall, which is a fracture of the fifth metatarsal here, right? And then got a diagnosis of oppositional defiant disorder. Put on more medication, right? Medication to, really sedate them. And this wasn't just one case I'm talking about. I was shocked that it was case after case after case. And by the way, I should mention, there's this thing called HIPAA, which is a privacy thing. This was before HIPAA. So
when did HIPAA?
I don't know. But this was before HIPAA.
Okay.
So we would, I could read these records. It was all anonymous. I didn't record their names or their date of births or any identifiers at the time, but it was before that. So I was free to kind of read these records. And every one of them told a story. Every one of them told a story that began when they were really, really young. And I thought this was about, this kid was 15, got in a bad situation. Who was the victim and who was the perpetrator? It was just a matter of luck.
Writing is on the wall.
So it was like, gosh, trauma, this is not some acute one-off event. It's like this chronic process. Because I said, those got to be related. You know, all this stuff that happened to this kid that ended up, he was gang affiliated, you know, on the streets, but he had this whole preliminary kind of childhood that was super, super stressful, full of all this stuff. So that got me interested. But that was it, you know, sitting there. And I remember, and at the time, the Kansas City Star actually posted on a Sunday pictures. This was a striking thing. And this was another thing that happened that was really motivating to me. They put pictures of all the kids who had died.
Yep, I remember that.
Of gunshot.
In the back of the paper, right?
Well, it was like page after page after
yeah.
page. And they're all black faces.
Yeah, I remember that.
They published their names. And if the case was closed, they put the perpetrator's name. And I'm sitting there looking at this just like in the office, right? And I'm going, holy smokes. And I have an older colleague who comes in. She goes, what you doing? And I go, Vidya, look at this. Look at this. Look at all these kids. She goes, oh, let me look. And she goes, and the names were there. She goes, oh, you know, that's a Children's Mercy kid. Oh, yeah, I've taken care of that kid. I recognize that name. Oh, I recognize, his mom, da-da-da-da. I'm like, these are our patients. We've touched these kids. And that became, academic curiosity about the relationship to a heartfelt sense of responsibility that we're touching these kids. So what am I going to do in my role as a physician? Because I know that I touch these kids, literally. So what can we do? So that was my motive. That's my motivation story.
And so through this, you became the chair of emergency medicine at Children's Mercy, correct?
No, I didn't. There was.
Correct me. Yeah.
I was a director for a while around COVID, just a couple of years.
Okay.
As an interim position, I did that. Yeah.
Okay.
For a couple of years. I don't see myself as a formal leader, so I never aspired to like have a formal title.
Right.
But I kind of. The pressure was on, so I decided to do it for a couple of years to kind of pitch in.
Yeah.
Yeah.
I love that because it's a servant leader. That's what you are. You don't know, but so many people are looking at you and counting on you, whether you accept the title of leader or not. But I appreciate it.
Thanks for that, Holly. You know, I believe leadership is not a noun. It's not a title. It's not. It's a verb.
It's a verb.
Every one of us has the capability, if we choose, to lead in our way, you know.
Yeah.
And you don't need a title. You
don't.
No, you do not.
We all know most people who have I call it the juice, probably don't have the titles. Then those are the people you really need to listen to because, you know, they have that they have that, just that knowledge that you can't learn.
Yeah.
It's experience.
Yeah.
You know?
Yeah. Yeah.
So, okay. Talk to us about the ER and like the social determinants of health and some of the things that you've seen. And we'll parlay that into equity.
Yeah.
Because, you know, what we do here at LISC and why you are a board member and a beloved board member for us is because of our work in trying to remedy those things of the past and to create really, really substantial equity amongst everybody in all thriving communities.
Yeah.
So if you don't mind.
Yeah, sure. So just a little more of a story. So I went and I got I went to a fellowship and did a research fellowship at this trauma center. And so my hypothesis was, you know, about this recidivism. Like if somebody's injured in a violent injury, what's the risk, the quantifiable risk of them coming back within a year? And also, what are the factors associated with a repeat violent injury in a year? And to do this, I actually worked with some of the researchers in New Zealand, believe it or not. They have a national healthcare system that everybody has an identifier. This is unlike the United States.
Yeah, I hear good things about this.
Well, you know, everybody has because it's I don't call it socialized medicine, but everybody gets universal
Healthcare.
coverage, health insurance.
Yeah.
So you can identify a person by a number, a unique identifier, and then you can track them over time. Can't do that work in the United States because that just doesn't exist. And so I was able to get 2 years worth of data. It was in big, huge data tapes, and do this big, huge cohort study, 3.3 million people in the entire population of the country, and look at the risk of injury recidivism by age, by race, and by income level. Now, in New Zealand, the Maori people are the people that have been the indigenous people that were much maligned, and they're the people who are most socioeconomically challenged, right? They're the indigenous people.
Right.
So what I found was what was the risk of coming back in a year for a violent injury was highly associated with minority race. Highly associated with young age, right? 20s, teens, and highly associated with poverty. And it was clear. And this was an entire country. This is 3.3 million. We repeated the study in Missouri and found the identical numbers, but you just substitute African American for Maori. And that's what we found. So, social determinants of health.
Jeez.
Right?
Yeah.
And these are powerful studies because they're based in population, not just in a hospital. The first study I did was just in a hospital, but this is powerful because it's the whole population.
Yeah.
So what's going on, And that's where we bring in all kinds of disciplines, right? From social work to sociologists to psychologists that have sort of a lens on this issue of socioeconomic status, minority race, gender even, being male, being highly associated with poor outcomes. I was looking at injury, but I'll tell you, subsequent studies have looked at heart disease, stroke, cancer, pulmonary issues, psychiatric issues, early pregnancy and prematurity, giving birth to a premature baby.
Yep, that was me.
That was you? Wow. So all associated with that.
Yeah.
So we know this to be true, right?
Yeah.
We know this to be true. So the why is the thing, right?
Yeah. And I was going to ask you, why? Why are we here? And what are we doing to remedy the why? Or are we? I know you are. I can't say the same for a lot of the people who are in your profession. I know you care. And I know that, I've been fortunate to have pediatricians who help me with my children.
Yeah.
And they are unlikely candidates. In most of my friends or family are like, oh, well, could you name a person of color who's a pediatrician? And of course I can, and I have. But they're like, well, who do you take your children to?
Yeah.
Her name is Megan Loeb at Leawood Pediatrics.
Oh, Megan, I know Megan. She's awesome.
I'm not surprised that you two know each other.
Yeah, tall Megan.
Tall Megan.
Yeah, she was a resident with us, so I helped train her.
I am not surprised.
She's great.
And I'll say this. When I met her when I was pregnant, I went in for a visit and I said, she kind of got my personality. And she's like, well, I look forward to working with you for 18 years at this time it was Raylan. And so then we had Christian, and two things, big things in the last couple of years for Raylan. And I'm getting a little too personal about Raylan's life, but Dr. Loeb said that there is a thing called precocious puberty that happens primarily in Black girls and Hispanic girls.
Yeah.
And she says, Holly, I hate it. And because of this, I'm sending you to an endocrinologist at Children's.
Yeah.
And they have things that we can do to prevent these things. And when I say our family was like, what? Then we're not doing. Yes, we are.
Yeah.
And yes, we did.
Yeah.
And yes, they intervened.
Yeah.
And it has been the biggest blessing.
How's she doing?
Great.
Yeah, good.
And it's emotionally, mentally,
Yeah.
physically, all of those things.
Yeah.
Second instance with my son, he has asthma just like his mother,
Yeah.
and he's a funny guy. He is full of life. He goes to a predominantly white school. And some of the teachers were like, well, should we get him tested for ADHD? And I was like, absolutely not. His doctor is a partner with my husband and I since the day he was born, and she's never indicated that he needed any of this. She would be the one I would talk to first, and she would tell me because we had that relationship.
Yeah.
And so I went and told her, and she just laughed. And she's like, Holly, we both know what this is about. No, he's fine.
Yeah. 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 That's so great. That's so great that you have a source of care for your kids that is so
Constant.
And constant, and kid focused, right?
Kid focused.
Because this, I mean, we could talk about ADHD, but the context that kids in is incredibly important. Social, it's the social emotional context, not just their parents, but their schools, and if and it can be negative, right? So we talk about those ACEs, right? Adverse childhood experiences.
Yes.
And those were studies that were done in the 80s on it was a white population, Kaiser in California, insured people. And they identified, this was Vince Folletti, and it was the primary author of this. But he and his associates identified several factors within a family that were associated with poor long-term health. And these factors were pretty harsh stuff, right? Like witnessing your mom getting beat up, right? Domestic violence. It was, a parent or a family member highly addicted, a family member in prison or jail, child abuse, right? Physical, sexual, emotional abuse. And these were a handful of things, but they were all within the family. And these were, they counted it up and they identified, you have this, and they scored it. The score of 4 or more of these things was really associated with really poor outcomes later in life. Early death. More than smoking, more than obesity. I mean, so powerful that you had to pay attention to this. But what they didn't look at, which subsequent things have done, in the last 10 years, 15 years, is the impact of systemic things.
That's it.
Discrimination, racism, living in a violent neighborhood, to show that poverty, to show that those things are really important as well.
And how that affects your mental health.
Ultimately, how it affects your mental health, right? And we've coined this term called toxic stress in pediatrics, right? Well, what is toxic stress? That becomes a question. And how do children experience it? And what can you do about it?
And what can you do?
Right? And the American Academy of Pediatrics, and I'm on this expert advisory team for them, is really taking this head on. And they want to kind of revolutionize all the pediatrics to make it where we really emphasize the strengths of a kid and to make sure that people know that the relationship that they have with their parents, caregiver is the generic word. Of course. I have a hard time using that. I like to say mother or father.
Exactly.
But caregiver, right? Doesn't have to be a
parental.
Parental, right. So somebody that is just nuts about that kid.
Yeah.
That loves the heck out of that kid.
It does.
That is the number one thing of importance. Number one thing, the relationship. Wow. So, the toxic stress, which is you have all these stressors from the things that I mentioned, including the systemic stuff in your neighborhood and discrimination and racism, which are huge problems.
Huge.
And if you don't have a caregiver who is deeply involved in that kid's life, who loves that child, to sort of offset that, we call them safe, nurturing relationships. Reliable, constant, safe, nurturing relationships. To offset that, then you're going to have a problem. So the ACEs are one half of the story. The other half of the story, the other side of the coin, is that nurturing relationship and the things that are innate within the child that are help that kid adapt. Because we are human beings, there's this term coming up now that I've seen called anti-fragile. Humans are anti-fragile systems biologically. We survive amazing things.
Childbirth.
And not to say we don't, those things that are traumatic, those are bad. We don't want those things. But if we give kids enough support and we focus on what is really, really necessary and help them develop a sense of identity, because identity
It's a big thing.
is huge. Identity is huge. It's been shown to be one of the number one things that kids that have a real sense of identity, whether that's a cultural identity,
Yes.
a church-related identity,
Yeah.
being part of a community, an ethnic identity, that matters.
It matters a lot.
That matters. And the story they know about themselves, even if it's back generations, for better or for worse.
For better or for worse.
If you know your story and where your people came from, that's actually a resilience factor.
It is. Oh my God. We were just having this conversation with our daughter
Really?
about, she's in 3rd grade. We live in Lee Summit.
Yeah.
You already know the issues that we face there.
Yeah.
Particularly being a highly educated Black family, a
Yeah.
highly historically Black college or university, Howard University,
Yay, Howard.
Yay. And being proud of that, right? And passing that on to her in a way that is not where she has to show up in the crowd of majority white students not being comfortable with her curly hair.
Yeah.
Or that her mom's in a sorority and her sorority colors are pink and green. So I'm going to wear pink and green because I'm a legacy.
Yeah.
Just little things like that. Or even like when they learned about in 3rd grade, the slave trade.
Yeah.
They didn't tell them the full truth.
Yeah. Yeah.
So we had to sit there and actually explain this to her.
There were some things omitted. Yeah.
And I told her, omitting things is still lying.
Yeah.
Lies by omission.
Right.
And so how I saw that wear on her mental psyche, her physical psyche.
Yeah.
And to that point, I was telling you about the precocious puberty, all of those things as a Black girl growing up in a majority space.
Yeah.
I'm like, did we do the right thing?
I'm sure you did.
Did we to that point of how your family left downtown Detroit and went to Southfield.
Yeah.
How everybody did that. That's what you do when you come into a little bit of cash.
You protect your family. You take them away from danger.
You try to, but then you're inherently maybe putting them in a different harm.
That's an interesting point. Yeah. Yeah. Yeah.
And so we talk about these social determinants of health with her. I talk about how not everyone has advocates in the health system like we do in Dr. Loeb and Dr. Denise Dowd. Some people don't have the access to education. Like, when you're in school, you have the kids that have to go to the safe seat. That's what she told me this morning. And then, because we were talking about detentions, and she was like, but most of the kids who have to go to the safe seat, Mom, they look like me. Yeah. And it's not a lot of us in the school.
Yeah.
Well, girl.
Yeah. And that's, what we don't realize is the kind of invisible stress that puts on kids to have that, to be discriminated against, right? Or to be other than the rest of the people. That is not a nothing. That is a form of stress which works on a developing brain. It does. It works on the wiring. And as the more we know about neurobiodevelopment, the more we understand what it's doing. What it's doing for we could get all scientific here, which I'm not going to do, but there is a whole, brain access. Your brain is being shaped by the stress. Your body responds to that with stress hormones, inflammatory markers. You can go on and on and on. Makes asthma worse, for sure.
Yeah. I'm a witness to that one.
Yeah. And Dr. Bridget Jones, who's one of my colleagues, she has studied this, right? So we're just learning so much more about it. And it's interesting because it's very humbling as a physician trained in a biomedical model.
Yeah.
The amount you can do with traditional biomedical things, medicine, right? Here's your diet.
Can we stick to diet real quick?
Yes, yeah, sure.
Have y'all seen the cost of fast food recently?
Oh, I don't know.
We typically don't eat fast food, right? We let them eat it maybe once a week
Yeah.
on Fridays. And they typically want to go to like a Chick-fil-A. Whatever.
Uh-huh.
$50
For how many people?
for.
That's a lot.
That's a whole lot for some food that is not wholesome.
Yeah, I know.
And I started thinking, and I was telling the kids this, like, not everybody has the ability to drop $50 on some dang old, excuse my language, some dang old Chick-fil-A. Number one, it's cheaper to make food at home. But then also, you got to think about what you're putting into your body.
Yeah.
And this is a reason why we don't eat this all the time.
Yeah.
And then Raylan was like, well, Mom, not everybody goes to the grocery store every week like you do. You are absolutely right. Because the inflation on groceries and just the ability, the people who have access to fresh produce and all those different things and having those things in your diet that help you.
Yeah.
And it's like, I told her, it's part of this whole society, the systemic issue that we are facing.
Yeah.
And these are heavy things to tell to an almost 9-year-old and
Yeah.
a 5-year-old, but hey, you got to learn somewhere.
Yeah, and and how do they make choices, right?
How do you make
And the other
choices?
thing is fast food and sugar and fats, those are addictive. I mean, those are addictive, and to realize or teach kids about, companies want you to eat this. They're going to do whatever they can to get you so that you're going to crave this.
Exactly.
And so that's why diet is so important.
And then you wonder why you wake up umpteen years later, you're diabetic, you have heart disease, all of these different things that we didn't know about.
Yeah. But back to, one of the things about making it better. Mm-hmm. There's a woman by the name of Ann Mast, and she's a researcher I think she's a nurse, but she calls, the ordinary resilience that people have, that parents bring, she calls it ordinary magic. Because people say, well, what do you do about it? I said, it's basic. It's not complicated. Relationships with somebody that really, really loves you. Routine. Kids need routine, right? A reliable routine. Get up for school, come home for school. This is when we eat dinner. We eat dinner as a family. Mm-hmm. We do things together. It's reliable, and it's routine, and it's safe. Those things parents can control to the extent that, they don't have to be not present because they have to work 2 or 3 jobs.
Exactly.
Right? So poverty plays into that.
Absolutely.
But it is ordinary magic. I mean, which, takes it down a few notches from this complicated, looking at systemic things, which are also important. But the basics are the basics for raising kids. And it sounds like you've done an amazing job with your kids.
It's a struggle, y'all.
But, back to that, identity thing, I really, really love that you're working on that with your daughter, and I'm sure eventually your son, too, because we know that kids want to know their story, and it does help to know where you are in the world, the tribe to which you belong, right? It gives strength to people.
A sense of belonging.
Yeah. And it's ironic because identity is one of those things that people are attacked over.
Absolutely.
Right? That gets them into trouble.
Gets them into trouble.
So.
That is so true.
Yeah. So that's this idea of, and I'm really interested in your thoughts on this, Holly, is it's interesting, I started working in the days of EEO, equal opportunity, where everyone's equal.
Yeah.
There's no difference.
No.
Or I'll just treat everybody. Can't we just all get along? Just treat everybody differently. But, that's not natural. It's natural that people are different.
And that's good.
And that's strength. Mm-hmm. So, and I wonder for you as a Black woman, the shift from, well, I'm just, fitting in with mainstream to owning a unique identity, which is yours. And having strength in that identity. Wow. You know what I mean?
That's a heavy question.
Well,
it didn't come easy.
Because I don't know.
It didn't.
I would love to hear about that.
It didn't come easy. And everything you said was so true. It pointed to my parents, me having a sense of belonging with my church.
Yeah, yeah.
And my parents telling me my identity and who you are, who you're going to be. Now, I did the opposite sometimes because my dad told me I was going to be a lawyer and I went to law school. Hated it,
Yeah.
but end up doing this, which has been great. But I will say, as a Black woman in 2024 who's raising kids, who is doing the part of trying to remedy some of those inequalities, particularly racial inequalities in this world, it is freaking exhausting.
Yeah.
And it's heavy. And it's not just me as a Black woman. And I look at our team. I love LISC, and for LISC to give me a platform like this, and just the things that LISC actually does, and a lot of people, whether that's our work in our financial stability, our economic development, our affordable housing, and we haven't even touched housing, and that's something we have to touch on before we wrap up. But just doing this work in community development, particularly community development for people of color, who come from underrepresented communities, it is daunting. Because it's like you're fighting, to that point you said, you're fighting this invisible system that just will not go away.
Yeah. Well, who holds the power?
Who holds the power and the power dynamic, and no one wants to shift the power.
Yeah, that's the hard thing, right? The letting go of the death grip on the power, right?
The letting go.
Yeah.
Whether that's through funders, shout out to some of our funders. We love you.
Yeah.
But it is what it is.
Yeah.
Whether that's changing the system of affordable housing that we're trying to do in this region.
Yeah.
By our regional housing partnership, and even just the individual housing work that LISC in general does.
Yeah.
And Jeff quotes this all the time. 1 in 3 families are housing cost burden. Yeah. And for us to raise families in these, thriving communities, but yet our grocery bills are continually going up.
Yeah.
Property tax, that's a whole nother thing, Jackson County. Another thing. All of these systems that have been put into place.
Yeah.
It's exhausting.
Yeah. And it's interesting, in my work, it mattered, like coming to realize it's just not enough to adopt diverse or equitable or inclusive policies.
It's not.
Is that the power who's in the room?
Who is in the room? Who's at the table?
Who's in charge matters.
It does.
And it matters whether you say it or not. It's not equal. One leader does not equal another leader. Mm-mm. They bring their unique set of experiences and their unique internal strengths and their unique history. Mm-hmm. That matters.
It does.
And so for things to change, to be quite blunt, white male dominated systems, that needs to change.
It needs to change.
And it's not enough to, but I'm a white male or a white female. Oh, I'm not racist.
Exactly.
I'm not this, I'm not that. No, you may not be.
Right.
But it matters.
Your worldview.
It's the worldview. It's the history. It's from where you came, who your people are. Because something, it's you inherit that, and we also know now with this field called epigenetics which is epigenetics is we think DNA, people's concept, right, was nature nurture, right?
Yeah.
That what influences you is what the genetics that you inherit from your mom and your dad, right?
Yeah.
And it's just laid down, and that's it. You can't really change much. But guess what? That's not true. We now know that is not true.
Yeah, it has
what
to
happens? So whether you're talking about an environment where you got lead in the Flint, Michigan,
lead
in the water, or
even Jackson, Mississippi, that still currently has
Yeah. So we know that, and I'm calling out heavy metals, lead, because we know
Yes.
that what that does is change the way the DNA is expressed. Okay. So that means that it's, inheritance isn't that. The environment you live in actually influences what DNA is expressed. So some things are shut down, some things are turned up. And this happens through modification of these proteins.
Yeah.
And we know this, or methylation of DNA. And so that is a physical change that occurs not just with heavy metals like lead, but with social, emotional stressors. So we're talking about discrimination, we're talking about racism, we're talking about abuse,
Yeah.
we're talking about a parent in jail, extreme poverty.
Extreme poverty.
It's not just like, okay, well, it's a soft call. Yeah, that's really tough. You grew up. No. It actually changes the way your DNA is expressed, which becomes who you are physically, your brain, the wiring you have. You see? So it's like that matters. That biologically matters. Now, our healthcare system is not designed to address that at all.
And I can say I kind of get why it is not, because if we look at how this world is, particularly this country has been set up, the systems and all those things, where do we go from here?
Yeah.
Like, what does it look like 10 years from now? Please tell me there's more of you. Like I know you're training other doctors, and I know they won't be just like you. They won't have the heart and the experience and the worldview to shape why they are doing the things and the passion that you have. But as a parent, as a human in this society, I need some hope.
No, you know what? They're not me. They're better. Okay.
Yeah.
No,
because you're better.
No. They're better,
and I'm glad.
They're better
for you to say that about this next generation.
They're better.
That's
because
a whole lot.
The arc does bend towards
Yes.
what Dr. King said.
Yeah.
Towards justice.
It does.
And I believe it. And I believe that because I've seen it. It's very slow. And there's a lot of noise right now that's trying to push that arc back.
It is.
Boom, And I may take it as the loudness of that response is an indication that it's working, that some power is being, shifted a little bit. But the students that I have and the residents that I have are amazing people. They come in as kind of natural advocates. They do. They want to make a difference. And I think the more we know about the neuroscience of development, the more optimism there is. We know that, that people innately are strong. We really are. We're self-healing. We're anti-fragile. Mm-hmm. So when I look at a kid, even that, I was just over at Operation Breakthrough here in the capstone projects yesterday of the kids from Hogan and from De La Salle.
Yeah.
And those are kids in poverty, okay? Yeah. Those are kids who struggle with lots of difficult situations. And I listened to their capstone projects because we have the ignition lab over there, Yeah. Thank you, Travis Kelsey.
Yes.
Thank you, Travis Kelsey, for helping that. Come on and see these kids.
Yeah.
And Mary Esselman and the work that she's done. I mean, Sister Berta, God rest her.
Yeah.
All of that stuff, that's look at that. I mean, it's getting better and better. It's slow. So I just keep on keeping on. Mm-hmm. And I have faith. I do have faith that things are getting better. So
that is a perfect segue to end our conversation.
All right.
But I would be remorsed, especially on a LISC platform, if we did not touch on a little bit of housing.
Yeah. Right.
And all of those different things regarding housing. So maybe 2 more minutes.
I'll tell you, from my early career, the impact from when I was working with the kids from Cabrini Green, who lived in those high-rise federal housing developments, which are no more, thank God.
Yeah, they went down.
Kids falling out of those windows, okay, very early on, and dying or being really injured. Talk about housing. We understood that didn't work, right?
Yeah.
So those are no more. Mm-hmm. To the housing where kids have physical dangers because landlords don't fix what's wrong. One of the things I saw in Kansas City when I first started working here were actual burns on kids' feet from walking on the grates in the
The
floor.
crates,
And there was
yes.
fire. And they would tell me, there's fire under there. I'm like, what do you mean there's fire under
It
there?
literally was.
And I was like, you got to be kidding me.
Mm-hmm.
And so that's that's just unsafe housing. And I would call landlords and I would say, listen, there's little kids in this apartment. That has to be fixed. To pools that were not secured, all that kind of stuff. But to not have housing or to be homeless, right? Mm-hmm. Or houseless, right? Because it's not, you think of people on the street, mm-hmm. but really, and I don't know what the statistics are in Kansas City. You probably know for housing deficient people, they're couch surfing.
Yeah. Yeah.
Right? They're staying with their sister and their aunt, and then they get like wear themselves out and, do that kind of thing. And that's more common than just straight out homelessness. And I have a brother who's homeless. My youngest sibling is homeless, but he chooses to be homeless because he struggles with addiction. And there's rules.
Of course.
There's housing there. He lives on the West Coast and he's got plenty of opportunity, but doesn't want to obey the rules. But that's not, they're going to tell me no drugs or alcohol. I'm not going to live there.
Yeah.
But that's not what we're talking about.
We're not.
We're moms, who have kids who are struggling to survive, may sleep in their car, who, go to their friend's house, who, go to their sisters for a while, that go to their brothers for a while. That's what we're talking about. Mm-hmm. Now imagine trying to raise kids like that.
To that point where you were saying stable, they need routine.
100%. We
know.
All
of these are adding into the little adults or the big adults that they're going to turn into be.
Oh, yeah. I mean,
who are going to shape our world.
Right. So to have that challenge is super basic. And then you roll that into transportation as well. That's another issue, right? A whole nother issue. One flat tire away from complete, devastation. And that's literal. I mean, but kids need a safe place to sleep, to play, to go to school from, right?
And here at LISC, we talk a lot about affordable housing.
Yeah.
And sometimes that may not even be like, it could be home ownership, but you got to get to home ownership, right? Yeah. There's some steps there that I feel like sometimes we as a society are missing to those points of touching those people who we were just talking about.
Yeah.
Yeah. This is why
it's basic.
It's basic.
Abraham Maslow, okay, he was a sociologist and, hundreds of years, I don't know, not hundreds, maybe 150 years ago. I don't know. But, that is true today. So what he said that we know is true is, listen, before you can learn, before you can care about your, moral development, become actualized or whatever it is, or have an identity, you got to have air to breathe, right? Yeah. That's dumb, right? Mm-hmm. You got to be able to eat.
Clean air
to breathe. You got to have food to eat. You got to have shelter. You have to be safe. Mm-hmm. And if you don't have those very, very basic things, basic needs, you're not going to be able to go up the pyramid to become a developed, educated person. You just won't. Because first things first. Right? First things first.
First things
first.
And
that's why I love what LISC is doing with housing. Because it's like first things first, right?
First things first.
Yeah, 100%.
Any closing remarks?
No, just thank you. Thank you. And, I love being part of the lab.
I love you for being a part of it.
Well, it's great. It's very optimistic and kind of brings it full circle. So we'll just keep on keeping on.
And I will go on record to say this. Dr. Denise has been an advocate for the LISC staff. She has challenged us in ways that will make us greater than and with a greater impact than what we have right now. So just stay tuned, and thank you so much for being that foundation for us.
Thank you, Holly.
Push that we needed. And
thanks for your work here at LISC.
All right. That's this month's Community Wise podcast. We thank you for joining us, and we'll see you next time. Bye.
All right.